do you want to get it started or do you want me to?
Oh, go right ahead.
Okay. All right. Thank you for joining Finance Committee on Wednesday, June 23rd. And we've got a year-end agenda today. So we'll have a few updates, a few conversations, and looks like Dr. Hall is joining. Welcome, Dr. Hall. Can you hear us?
You guys hear me?
We
Yes.
can. Can you hear us?
Okay, sorry, I didn't realize I had my computer.
Okay, great. Hey, welcome. And welcome to June 23rd Finance and Capital Management meeting. This is our last finance meeting of the fiscal year. I was talking to Diana that this is kind of the end of my year. This is when we hit the reset button on everything from audit to fiscal year expenditures to next year expenditures and budget and grants. So in the time of the finance office, the busiest time for our office is the last 2 weeks of June and the first 2 weeks of July. It takes about 2 weeks for us to close the fiscal year-end books and put to rest all the hundreds of thousands of transactions and get them ready for next year's audit. So there's a little bit of that theme throughout today's meeting, but let's just start with our previous meeting summary. Hopefully there's no updates or edits. Ruth and I will give you an overview for the next board meeting coming this Monday, which just to get you caught up, we are trying to combine that with a board retreat. So we might just keep the business very short so that we can get to the retreat items. That makes this meeting even more important in terms of end of year documentation. So with that, let's get into the items. Legislative overview under 2.01. And I can share my screen if you like. Does everybody see the screen?
Yes, I do. That's even better.
Okay, great. You see the Fair School Funding Plan outline?
Yes.
Okay, great. So this probably represented our last round of, yes?
So I'm having a wonky internet connection, so but just so you know, I'm in re-click the link to try and get a better connection. So
okay,
this is just a heads up.
Let's let him reconnect.
Okay, I think it's working. Okay, sorry, Ryan, go ahead.
Okay. Attached is the Fair School Funding Plan outline. Representative John Patterson, myself, Tom Hostler, and Mike Sobel issued a press release, kind of a last effort, if you will, prior to the conference committee. Conference committee has been in operation now for about a week, and we hear, and obviously with the end of fiscal year, but we hear that those ongoing discussions could result in an amended budget bill, could be later this week, could be early next week. And our hope is that they embed major portions of the Fair School Funding Plan. So that is it on the legislative front. Legislative tracking tools, theirs last updated in May 27th. There's a couple of bills introduced over the past couple of weeks. I don't know if they'll get any traction here during budget season, but we will revisit them sometime in July. A couple more updates. ESSER funds, we continue to keep our memos updated. So anybody watching or any stakeholder, including the board, can go on and check to see where we are with our spending. Together with Superintendent Fowler Mack, we've begun our discussions, and I think I framed it in a way that to date, really, we've been looking in the rear view mirror, trying to relieve general fund as much as possible, qualify as many expenses of what has been covered since March of 2020 to today. And as you will be seeing in future discussions and meetings and updates from summer school and intensive academies over the summer, you're starting to see current and future programming on ESSER. I do want to highlight that I have continually updated my professional association, the Auditor Estates Office, and the Ohio Department of Education on what I presented to the board during the 5-year forecast in May, if you remember, on the maintenance of effort issues that may need to seek a larger state of Ohio waiver, could include a federal waiver, but obviously we don't want to get to the end of the timeline of those $140+ million of funds and not be able to spend them based on a rule that's not intended for a global pandemic. So I will keep you up to date on that. Under the health insurance rates section, I would like to highlight this for you and the board so that you can update your fellow board members if asked, or stakeholders the like. Does everybody see the attachment there? This is from the finance department to the benefits office. The benefits office then includes all of the bargaining groups and employee classifications in the district about what our annual health insurance rates are. Let me give you a quick overview of the process, and then I'll give you the substantiating documentation. Every April and May, we use our healthcare consultant, which we'll be talking about next, to come up with our annual rates for medical, prescription, dental, vision, workers' compensation. I even leverage them in their actuarial services on some of our other non-related medical funds, just so I can kind of triangulate my data, so to speak, when I'm making estimates for next year. Over the last few negotiated agreements, Akron Public Schools, as well as many school districts around Ohio and public government entities, have gone from a fixed dollar amount in terms of what employees pay to a percentage of the premium. And the thought there is, as health insurance rates rise, employees are participating, and that there's also some incentives built in. Akron Public Schools has taken an additional step towards incentive, which is represented there. So in the middle section, if you're following my cursor, maybe I can even highlight these. Our contributions for single and family rates are split into two categories: wellness and non-wellness. We did this as a further incentive to participate in wellness, drive employees' costs lower, and obviously improve the health and welfare of our employees. Akron Public Schools, the Health Care Benefits Advisory Committee, which is made up of many of our union chiefs, we believe that this is a shared responsibility and a responsibility, so to speak, in terms of public service to improve the livelihoods of our employees. This isn't just a benefit. It's much more than that. It's much more than that, so to speak, that I think the Healthcare Benefits Advisory deserves the credit on Paladina for driving some of those wellness initiatives as well. So down below is the contributions that employees pay. This starts on July 1. Just to give you an example about how this has grown and what employees are participating in. Last year, our wellness single was $60 a month, and our wellness family was $152 a month. So an increase of $6 and $15 respectively. Non-wellness was non-wellness was 98 last year. Now it's 108 and $247 per family, an increase of $10 and $25 from previous years. So modest increases, as you can see, the effective rate there in the paragraph established that our annual rate increase was 6.6%. So I just want to give a quick history and why I think that's a very reasonable number, why that there's some science to it and some artwork to it. 7 years ago, in the first 2 years, we received, I think, a 17% increase in rates and a 12% increase in rates. Part of it was budgeting philosophy of my predecessor and how kind of the classic review of health insurance rates, and a lot of it had to do with a lack of incentives built into our health insurance program. So we teamed up. We teamed up with our new healthcare consultant, Paul Catania at Oswald. That happened, I think, about 2 years into my tenure here. And then with HBAC to begin this journey about addressing things that are driving cost. And since then, we have not had, and so for the last 5 years, we have not had a single increase above 5% with the exception of this. In fact, there were 2 years at 0% and 1 or 2 years at 3%. We have beat trend while adding cash reserves to this pool, which unfortunately, we thought utilization would be driven down during the global pandemic. We had some high claims year. We had some members drop off, which means that the insurable pool is lower. Not what you think sometimes, but drove costs up. And our initial estimates with rates were over 12%. And if you are seeing the other attachments, if I can get to them, let me bring that one up. I know I have another one. I'll send you my rates attachment. This is our claims experience. I'll send you my rates attachment so that you can see how these rates were developed, recommended at 12, then at 10, and then ultimately, because of the health of our fund, we were able to pull this back to 6.6, and how we substantiate that number, I think, is really important.
Hey, Ryan, that claims experience document, that's one of the attachments, right?
It is, yes.
Okay, all right, I'll pull that up.
Oh,
and then I actually had a question for you, and I'll be honest, I haven't had a chance to review all the attachments.
Sure.
But on the first page you were showing, if you go back to that document that had the single versus the
yes.
Yeah, that one right there. So let's make sure that I'm understanding right. So so are we mixing percentages and so for example, there's the single that's 66, that's 66, is that on average 8% represents that dollar amount?
So if you take 8% of those rates above, so that's what our authorized rates are. So the 829.91 and the 2,085.72 represents about a 6.6% increase over the previous year rates.
Okay.
And so the contracts, negotiated agreements say that our wellness percentage for employees to share in the cost is 8%, and our non-wellness, those who choose not to participate in any of the Be Well or any of the initiatives, pay 13%. And that's been in this last contract. It's up a little bit from a prior contract. And maybe what you're getting at next, hopefully this answers the question, is it's about 50-50, Dr. Hall, where our employees, actually, I think it's actually now more like 60-40. I can get the exact numbers of participation rates. That number has steadily grown with Paladin and our wellness initiatives.
Gotcha. Okay. Yeah. So, right. So the dollar amount for singles, the $66 amount, that basically is 8% of the 829.
Correct.
Okay, gotcha. Now, is that, I'm trying to think here. Is there any risk adjusting that you've employed or that they've employed in coming up with these numbers? I mean, because a 25-year-old and a 65-year-old are going to have that are single are paying the same rate at 8%. Let's make sure I'm following that.
There is no risk adjusting.
Okay.
The risk adjusting is done on the entire insurable lives.
Okay.
I was able to find this. This is also attached to the board. And so this substantiates how we drive the medical, prescription, and combined. And then ultimately, you can see where it's substantiated a 10% increase. And Dr. Hall, I think this will speak more your language.
Yeah.
About projected claims, but the entire insurable lives is valued as a whole. I think you're talking innovation there. You're talking next level, and that's something that we can add to finance committee in future, from help savings accounts to variable rates. So there's a future opportunity, I believe.
Yeah, because I know part of it too, Ryan, is I know that some places, a lot actually offer an HDHP, right? I mean,
Right.
so, where basically if I'm a younger person and I'm healthy, I can still be saving money back, right? But my savings when I'm putting into my HSA, it basically functions as a medical 401k, that I can accumulate, and then down the road when I'm less healthy and I could either stay in an HDHP and use that money to cover my copay up until up to reach my coverage, my limit before the plan starts taking over, or so I'm sorry, I'm going down a rabbit hole here, but point being is that, so we don't offer an HDHP option, or HSAs are obviously with that. I saw you mentioned the wellness component of this. I know a lot of employers don't allow their employees to smoke. For example, at Summa, you can't be an employee for Summa Health and smoke, right? And so, and when you come to work for us, they test you, right? And so, they're looking for nicotine levels. If it's above a certain amount, then you actually can't come work for us. And Diane, I wonder if Children's has something similar in place around that. But there are some things that you can do. Conditions that you can place on your employees around to ensure more healthy lifestyle practices. Again, tobacco is one of them. That's kind of an easy one. I know companies have been doing that for over 10 years now. They've been prohibiting smoking. Again, you can't get in. Well, either you can't be employed, or your rate is much higher if you smoke. So I don't know. Have we had any of those kinds of conversations? Or is that or are we lumping the smoking? Is that one of the wellness questions? Again, I guess I wasn't sure how we were defining wellness here.
All right, so two areas of questions that you asked. The first area, so let me respond with maybe the overall, why haven't we driven further initiatives like HSAs or combined savings plans, and maybe an a la carte. And quite simply, it's this, is that Akron Public Schools has had a magnet plan for some time. The relative cost, based on what we've learned about over the last 3 to 5 years, the relative cost of public employees is somewhere around the neighborhood of 13% for the entire population. So if we blend this, we're somewhere north of about 8 to 9%, right? 60-40. So maybe more like 9%, maybe 9.5%, where they're sharing in the cost. So up to this point into this prior contract, Dr. Hall, there probably wasn't a need because there wasn't enough savings mechanisms needed to set aside those dollars. Now, I would say that obviously by saying claims will increase. It is one of the fastest growing components of inflation in our budget. But I see this transitioning, as well as the concept that we talked about a few minutes ago about variability in the plan from a younger person to an older person on our plan, or somebody who chooses a healthier lifestyle from the smoking cessation and those kind of things. So the second part of your question was, yes, we've looked at those cost drivers for our plans. And I think what you're going to be seeing probably between now and December, as we're taking a deeper dive, not only with HBAC, but as we prepare for negotiations, we make changes to the health insurance plan that helps not only create incentive, but drive costs down or lessen the amount of expense, right? So we're trying to stay ahead of inflation on a new, not generic prescription drug that's driving a ton of costs. So we may layer in step therapy, or we may layer into wellness. You must be in a smoking cessation program to achieve wellness. Those are all future conversations that I think are on the table.
Yeah, no, I appreciate that, Ryan. Because a lot of this gets back to sort of plan benefit design, right? I mean,
Right.
like how we're designing it, and I know that there's public system is going to be different than maybe the corporate side, as far as what you can get away with doing, or how fast you can do it. So that's why I was kind of asking the questions around, because there's a lot of different things around preventative healthcare measures, activities that we can kind of do with our populations and provide incentives around as well that can further reduce their rates and their expenditures if they agree to engage in certain types of activities or not engage in others, right?
That's right. We will be utilizing your expertise for upcoming negotiations as we look at plan design.
Yeah, I'd love to be a part of that too. And then you mentioned some of the step therapy, like that they sort of require on the prescription drug side. That some of that's great. Some of it though just creates more problems as well. But in theory, yeah, I mean, if you're putting in sort of what's called or utilization management sort of measures in place to ensure more appropriate utilization, that's key too. So. But again, I think about the average age of the population, which was the average employee age like 48, 47, 48?
I haven't looked at that for a few months, but that seems right.
Yeah. Yeah, I think that was the number I last year was like, it was 4. I think when we were discussing COVID, and the risk of the faculty, I think we were saying, our average teachers or average faculty age was like 48 years old. And so that means half of them are basically in the at-risk age group for COVID, which I think at the time was most age 55 or age 50 and above,
Right.
So, or a quarter of them would have been if we used age 60. But yeah, so that's why I was saying, like, having some additional sort of options on the table, and we have enough people with 4,000 employees that you have people that you could definitely develop a variety of options.
We've got close to 7,000 insurable lives on our plan. So we are actuarially sound. We don't need to add lives to make an actual sound population to drive costs, for sure.
That's right. Yeah, you have enough, and also too, just consider like what's in network, out of network from a hospital standpoint. How do we price ED visits versus urgent care visits, right? I mean, because there's a balance there too. 'Cause I know that you've got 2 health systems here in town, and there's about, even looking at objective data, one of them is about probably on average 25% less expensive than the other one, right? So, so how do we drive or design the plan to drive patients to the lower cost provider, right? Assuming equal quality, right? I mean, so and we want to have that conversation too. So that's where. So yeah. So I listen. So when do we start negotiations again?
Well, contracts expire June of 2022. So. Okay. I think this fall, what I'd like to do is dedicate a finance, one of the major part of the presentations, to have Paul Catania come in and detail the plan design, kind of where we have been, where we are now, what the future looks like. It's very similar to what he does with our healthcare benefits advisory committee with employees. Mm-hmm. We'll definitely put that all out in the sunshine. Everybody can participate or tune into it and kind of see. And that should give everyone an idea of if we collectively want to control future inflationary costs and drive costs down, which has been a great partnership with all of our employees, that gives you an idea where we need to focus. And I'm sure you know a lot better than I do, both of you. There's something new on medical spend every year that drives cost. So it's never going to be a static situation.
And Ryan, I'm assuming from this slide that we're self-insured and that we use a TPA basically to sort of administer the plan for us, that we're paying a fee to.
Correct. Yeah, we're self-insured. So that's a standalone business. It is not included in general fund.
Yeah.
As you can see, it's a $50 million business. We hire Oswald, which we'll be talking about that contract next. And we have streamlined our providers. Last time that we went to bid, we had 3 different providers. We currently have 1 provider right now with Medical Mutual. And then we do not hire an additional third-party administrator in between. So all of that work now is done between the consultant, our internal benefits department, and Medical Mutual.
Okay, gotcha. Yeah, and Ryan, again, I don't want to upset the apple cart. I just, would love to kind of be.
You're not going to upset anything. You're going to
part of the conversation.
Both of you are going to be a critical team member to this conversation.
Okay, perfect. Okay,
it's a big spend. I want the resonance of this is our largest single expenditure outside of personnel.
Mm-hmm.
This is in controlling costs saves money for the classroom.
Yeah.
So it's an important point. We shouldn't overshadow it.
Gotcha. Okay, I'll be quiet then. Go ahead.
Please don't.
Go ahead. Jump in.
Please don't. I don't have my screen on, so I can't see you, Ms. Autry. But if you have some questions, go ahead and stop me. Next up is our brokerage services contract with Catania. This is on about every 2 years, and I have it open somewhere. I opened all of these. It's a 10-page document, but I'm going to go to the end and the appendix so that you can see the scope of services. As you can imagine, one of the most important things there is at the bottom, and that's to help us negotiate the cost structure with our vendors and carriers, providers. That is probably the single most important thing that they provide. Our relationship with Oswald over the last 5 years continues to develop and strengthen. I've been in this business for now 17 years and worked with a handful of brokers and third party. I have nothing but the utmost respect. It is very nice to have this service literally across the street. They are very attentive to our needs, have folks here in Akron dedicated to our accounts. So no call centers, we have to talk to somebody in another state. We get regular visits in person. So this has been a really nice relationship. On top of this, what they've brought to the table in terms of the reporting and metrics, I would say has been critical to help us control costs. And their partnership is a direct result. I credit them much more than our finance office, and I credit the bargaining groups on the actions that we've taken. It has been a joint-led process. So I feel really collaborative about this relationship and recommending that we renew them for another 2 years. Their rate is included here at $84,000. When they started about 5 years ago, these fees were $75,000. So I think this represents it. Our contract last year, I believe, was $79,000. So what is that? About a 5% increase in services, and it's for 2 years.
Hey, Ryan, quick question. So, you mentioned going. So this has been put out to bid, right?
It's a service. It doesn't require a bid. We shop, I would say, every 3 to 5 years or when needed. I think you've seen that on some of the workers' compensation and changes and
Mm-hmm.
attorneys with things like that. So it's not required to go to a formal RFP. We are required on the major part of the spend, the 50 million, we are required to go to RFP. In terms of best practice, it's not, you have to go every year, but about every 3 or 4 years we go out to bid.
Gotcha. Yeah. So I asked because if you scroll back up a bit, you were showing kind of the suite of services that they provide around. There it is. Yeah, that data reporting piece. Because I know I've worked with a couple other folks that are probably larger than they are around some dashboard design and whatnot, and some reporting, kind of a sort of a reporting toolkit.
Sure.
I like to kind of compare offline to what they're providing us.
I would love that. I would love that. So we can, I would like to dedicate a day in the fall, September, October, where we're taking a deep dive into our plan design, our portfolio in terms of this is what we have in terms of cash reserves, our kind of our overall risk analysis. And I think that would be, we can do it between now and then so we can be better prepared, but we certainly could add it to that agenda too.
Yeah. And again, I'm not suggesting that Oswald. I'm not suggesting that Oswald's not doing a good job. It's just always just nice to kind of just to compare when you have data to compare. So I can kind of show you what I. Yeah.
No, I would like that very much.
Gotcha. And then Ryan, quick question for you. So you mentioned that. So it's a 2-year term. So basically, when are we due then to start negotiating with regard to our next sort of health plan coverage period cycle?
For our
employee health plan,
for our provider, or for our negotiated agreements?
For our because what you're talking earlier about, there was a 2-year, like this is that we renewed 2 years ago, and maybe it was when you were talking about.
Well, let me answer both of them, and hopefully that captures it. So we're starting the last year of our negotiated union contracts, and as you know, we have 6 bargaining groups, and they all align to the same years. So we should be preparing for and entering in negotiations at the end of this year or early next year. So that should drive some of our conversations. Now, you all know how I believe that if you only communicate in times of need, then you're not doing it right. So that's why I want to constantly engage HBAC, and I know the benefits office does that. And I want to engage the board in the conversations, that nobody's surprised, because when it comes down to it, money and insurance are 2 major drivers of our bargaining contracts. Nobody should be surprised about what's driving costs in healthcare. So if we're doing our job right, we're doing that. There's
Gotcha.
the other side of the equation. We have this consulting arrangement, which is a recommendation for 2 years, and we have our providers. Our providers are the medical mutuals, Summa Cares, Alt Cares, and the like out in the marketplace. And over the last 5 years, we have had as many as 3, and now are streamlined into 1. Medical Mutual has been that provider of choice. That is the formal bidding process outlined in the scope of services here.
Gotcha. So MMO basically is serving as the TPA for you all.
Correct.
And Oswald's doing all the reporting.
Correct.
That is super weird. That's super weird that's how that's set up. And maybe well, it's weird to me, right? I mean, but maybe it's pretty common within education to have it set that way. So because usually your TPA as a part of that fee is providing you with your reporting on your claims experience, since they're the ones who are actually processing it for you. So
and they do. We meet quarterly with our provider, and they do, and they have their own set of metrics. I guess what I would say the value is of a consultant on top of the services you see is to peeling back those additional layers and providing additional insight. So I don't want you to think that the provider isn't giving us annual reporting metrics. They are. And we get, I'm sure that Judy either pulls or receives monthly reports from them.
Okay. Okay.
And so we bring Judy into this equation. She's our expert. She's our benefits administrator. So she knows a whole lot more than I do.
Okay. Yeah, I'd love to sit down with her and kind of look at what she's looking at.
Yeah.
Again, just to better understand, because again, $50 million is a lot of money. And so it's just me just kind of putting my board oversight hat on,
Sure.
not trying to get in the weeds or tell people how to do their jobs, just understanding. I just want to make sure I understand sort of what we're doing and why we're doing it, kind of a thing. Believe that everybody's doing just fine. I just want to make sure that.
Oh yeah, no, I don't take it that way at all. I think that this deserves its time in the sun. As I said, it's the second biggest expenditure we have in the district outside of staffing.
Yeah.
And it's the fastest growing if we don't monitor it. So if we get a 10 or a 12%, that cost, one, passes along to our employees.
Mm-hmm.
And two, that's a significant increase of inflation to general fund, where you all know that our revenues are not growing at 6.6%.
Right. Yeah, exactly.
Yeah.
Well, and that's where too, the HDHP offering, it becomes something that you can do. Now, the pushback is that I don't have as many people in my higher risk pool. I mean, so there are arguments to be made on both sides.
Right.
Cost reduction and HDHP is a great way to reduce costs to the employer, because you're pushing more of the initial cost to the employee. And that's okay if you're talking about a younger employee group, which is why younger employees tend to opt into an HDHP. Because they don't mind that, because they're not utilizing it as much. But it can result in a higher cost to those who are left.
Sure.
From a plan, sort of from an actuarial planning standpoint. So Ryan, I'm sorry, I keep talking here. So we're paying. So basically, the Oswald that's $84,000 a year. That's $84,000 for both years.
That's $84,000 a year.
Okay, and then MMO is our TPA. What are we paying MMO?
I'll get that for you. I don't have what.
Just ballpark. I mean, what do you just ballpark?
I don't even know what our admin rates. So you want the admin rates. You don't want the discounts, and because the way in which the provider's priced obviously has layers.
Yes.
So
yep.
I will send that to you both.
Okay. Yeah, I'm just curious about just all in, like, everything kind of all thrown in. Like, what are we paying last year?
Sure.
So I mean, I know it's based on percent. I know that a lot of times it's on revenue. Yeah.
I don't know what your business lingo is, but I think it's like a per thousand or a percent.
Okay. Gotcha. Yep.
Yeah. Excellent. Okay. Any other questions on health insurance?
Nope.
Okay. Here's an interesting one I'd like to share with you and get some feedback. What I'd like to do is kind of get a head nod today to proceed so that I can engage some families here, and then we'll ultimately bring it back to the board for a resolution. So let me tell you the overview. Some 25 to 50 years ago, as you're aware, investment vehicles for individuals have only grown, right? With the stock market, from early annuities and life insurance, which were a way in which to invest, maybe some of the only ways to invest a long time ago, to what we have now, where you can trade from your cell phone and the like. So a long time ago, and I'm going to use the example that we were successful with. We had the unfortunate circumstance of the Challenger disaster, and that resulted in the school board and then Superintendent Ott to create a scholarship about science and mathematics. That resulted in many of our major corporate partners giving money to Akron Public Schools to invest, so I offer air quotes, and create an endowment. Well, when the sophistication of the markets back then, that probably wasn't a bad choice. Interest rates were 3 to 5%, sometimes higher, and provided relative growth and options. Now, we were able to invest in much more before the restrictions on public funds, and that restriction on public funds is a smart one, right? So we should only be investing in principal safety kind of items. But it has since grown or come to a halt in terms of the growth available to these type of endowments. It is my personal philosophy that school districts' books should not be set up as endowments. Some school districts have very robust numbers, hundreds of accounts where they endow them. They invest in certificate of deposits, treasury bills, commercial paper, and they credit back the interest to these accounts. They grow very slow. There is no market cycle, so to speak, other than yield curves. And I don't think this is best for kids. So it took about 2 years to navigate this because nobody in Ohio had done this before, but we teamed up with Squire Patton Boggs at the time, experts in this space, where they had some ERISA and some finance experience. And then we solicited, with that legal expertise, the state auditor's office to transfer dollars from a public institution to a private, which had never been done. Now don't be mistaken. These dollars are not sitting in general fund. They're not sharing of interest. They're not helping us grow health insurance pools or general fund dollars. They're not commingled at all, nor are they on the 5-year forecast. These are separate endowed funds. And if you look down at the bottom here, we have a few more that I'd like to contact with your permission. Seal Stotler Endowment Fund is a balance of $94,000, and we're investing in certificates of deposit there. The Schumacher CD is a maturity date with $5,000, and then we have a checking account. We are earning nothing in our sweep accounts right now, and we're earning about 0.2% in commercial paper. And I say that not because these endowments funds are invested in commercial paper, but because any and all of our other sweep account money is invested in commercial paper. These have very specific maturity needs, so we invest at 12 months at a time. We take the interest available, and that credits to a future scholarship. And that's where these monies don't grow. That's where Akron Public Schools is not in the business of designing an endowment where you can go out and market these things. So we were able to take north of 200,000, maybe just shy of 300,000, about 4 years ago, and transfer it to the Akron Community Foundation. And it has been partnered with not only the Community Foundation, but the Women's Endowment Fund, with the Resnick Scholarship. And now these funds are fully invested, professionally managed, and endowed. And we now have a few years and cycles where they're interacting with our school district and selecting future scholarship winners. And so the due diligence is what I was sharing with you here. I contacted Resnick family members, I believe the remaining family members in California, had a nice conversation and an email exchange where they really supported this endeavor. And special thanks to Akron Community Foundation for continuing to market these funds. And then also, as you know, before the tax structure changed, and for those large organizations, giving to a nonprofit organization is different than giving to a public nonprofit. So the IRS to tax determination that the foundation can give to somebody writing an annual gift has much greater benefit than if it were coming into us. So I need some head nod to proceed with this. I'll include it likely for a July board finance update, because I have a feeling we're going to be keeping our comments very short on the 28th. Does anybody have any questions or hesitations here?
Hey, Ryan, I'm just curious, I think you mentioned that we had quite a bit of this in commercial paper, right? And you mentioned that the interest rates were low. I mean, that makes sense because interest rates are typically low in commercial paper, because they're typically short-term instruments, right? I mean,
They
so I guess the thought I had was, I guess help me understand why we wouldn't look at something like a bond or again, it has again, not that they have got great interest rates either, but it's better than what you would see typically, through the lens of commercial paper. I guess I don't follow why it's in commercial paper.
Sure. Just to clarify, none of what you're seeing on the screen is in commercial paper. These are all either checking accounts, savings accounts, or certificates of deposits because they have annual commitments. So we have to take the interest earned on a year and return it there. And so that's why we tend not to do commercial paper in these areas, because we don't want 25 endowments where we're constantly managing a 3 to 6 month maturity and kind of that's a lot.
No, I completely agree. No, I completely agree. I'm sorry, I was confused. I thought you were saying that we placed that these were sitting in commercial paper. That's why I was like, what?
They are not. But to your other point, Dr. Hall, I would love to invest in other instruments, but Ohio Revised Code limits the use of public funds when they sit on our books to only invest in U.S. Treasuries, certificates of deposit, and commercial paper. And even the commercial paper is considered a risk. And we have to go through a special certification to invest in those instruments. And they now, I think with the new law, only mature out to 9 months and less.
Gotcha. Okay. I follow you. So I'm just curious, you mentioned the Resnick Scholarship Fund. I knew that existed. What is the size of that fund now?
It's got to be close to 300,000, but I'll get you that information.
Oh no, I was curious as a ballpark, and so because and maybe I'm missing this too, but I haven't seen who was the? I mean, do we have a list of who was the Resnick Scholarship recipient? Is that for high school kids? I mean,
yes, it is.
Yeah, I mean, I'm asking you a bunch of background questions that aren't germane to what you're asking us. This is just me trying to understand it better. So, so do we know each year who gets the Resnick Scholarship Fund and
we
the
do
Scholar Fund and all that stuff?
We do. We absolutely do. There's selection committees with representatives from the families and the high schools and guidance department who go through a selection criteria that's predetermined, and then they're annually awarded.
Okay, gotcha. Okay.
But you touched on something I would like to give you some additional vision. I would credit this with our discussions early on about 4 years ago, where our vision was, because Akron Public Schools doesn't have the ability to do these kind of investments and go through full market cycles and really add value for kids, the vision was to, as many school districts have, a foundation of their own. Some created as a 501c3 and they have separate board members to manage it. Other school districts are saying, we don't have the size and scope and capacity to do that startup and management. And they have been contracting. In fact, a number of Summit County school districts contract with Akron Community Foundation. So the vision there is, we have an umbrella that Margaret Medsey has been really helping to shape, where we have Akron Public Schools endowed funds. And we've got some families that have given over the time. So we have some for the arts. We have some for science and mathematics in terms of Resnick. We have some for work experience and vocational. And the idea and vision prior to the pandemic hitting was that we would have an area where we could direct endowed funds to go there, partner with Akron Public Schools, and then we grow those portfolios. So it's always been shocking to me why we didn't have a larger endowment available in Akron. So it's been a personal mission of mine to get that growing. So.
Gotcha. So Ryan, so two questions to that. I'm sorry, but first let me pause. Diana, I'm doing a lot of talking. Let me just shut up for a minute and let you jump in. I'm sorry, I didn't mean to monopolize kind of the conversation.
All right, see you guys.
If you want to jump in with questions or comments, concerns, let me just be quiet. Go ahead.
No, I'm good. I'm listening. I'm learning, and I know how to interject.
Okay. All right. Okay. No, I just want, so I guess the other question, Ryan, you mentioned that we're statutorily limited in the kinds of instruments we can invest in for dollars that are on our books.
Correct.
Did I hear you say though that moving these dollars to ACF is in effect moving them off our books?
It is, yes.
Okay. So that's also analogous to starting our own foundation as a separate 501c3 would achieve the same function as in moving these dollars off of our books into the foundation.
Correct.
Gotcha. So that made me ask, so this is another thing I wanted to ask you about. As we're thinking about the ESSER funds,
yes,
and the $100 million there, insofar as that frees up general fund money, could we not move some of those funds to an account that was sort of off the books to be a little more aggressive in how we grow it? Because my first thought was, gosh, wouldn't it be great just to stick that $100 million as a basis? I mean, because I think GAR is what, $120 million endowed foundation. They generate $8 million a year, and it's sustainable, right? So you're gonna get that every year. So in the long run, you end up with way more than $120 million, as far as in benefit, right? I kept thinking to myself, like, why can't we, why couldn't we just park those ESSER funds, use it to create an Akron Public School Foundation that then is going to generate in perpetuity, $6 to $8 million a year in interest, that we could use basically, in perpetuity, and my suspicion is that there's some limitations on that because those funds must be encumbered, right, by 2024. But insofar as using those funds in the next 3 years, freed up general fund dollars, could we not take those freed up general fund dollars and use that as the basis for setting up an endowed foundation that generates benefit and perpetuity for us?
No.
No. Okay.
It's a quick.
So passionate there, right? I was, yeah.
I know. Well, I had to go right for it because, I mean, Dr. Hall, you're just thinking way too innovative for the state of Ohio and how we manage public school dollars. Hopefully I've conveyed that through finance committee about why we're not chasing yield when we invest in dollars, but my team, I've got 2 members of my team, one sits right outside my door and down the hall, where they're managing daily cash flow just to earn an extra couple $100 so that we can, when we say, and the party out here is when we earn an additional $30,000, we just bought a teacher, and we kind of reward ourselves for that. But that's the quick no there, and apologize for that, is we're not allowed to transfer those dollars off. And because ESSER funds are reimbursement only, there's federal arbitrage rules where we can't invest that. I can't even invest it in commercial paper. I have to have spent it within 3 days of receiving it. And so it's held out in some federal and state account. I spend it, which means it's kind of on the backs of the administration and local here. And then within 3 days, we pull it down. Now, it will create additional flexibility in general fund, but the best we can do there is our current investment portfolio. And annually, we look at that at finance committee in the vehicles that we can invest. So I like your thinking.
Okay, so we can only move these funds off the books because they were donated funds.
Correct.
Okay, gotcha.
And they're non-general fund, non-operating dollars.
Gotcha. So which leads me to one more question here. So we've talked, as I know in this committee, we've talked, I want to say in the first year, Ms. Audrey and I were on this committee with you, we talked about a program in place where we start seeking out alumni to contribute to an endowed fund, right? So, and I know we never got past whether it would be high school specific or whether it would be sort of an all-in, but I can imagine, going to, Booked alumni and saying, hey, like we want to develop a fund that would just benefit Booked, right? I mean, that might be one way. And I think you probably will get more traction making it by high school because people feel more of a loyalty to their high school than they do the entire system itself. But I keep thinking to myself, gosh, if you went to certain high schools and said, hey, like, we'd like to, let's start sending mailers to, Booked or Firestone or Garfield alumni and saying, hey, we want to create an endowed fund that creates additional funds that will benefit your high school. Whether that's to upgrade sports, whether that's to provide uniforms, whether that's if we want to use it to fund extra teachers there, I mean, again, and so my question was, is that something that's still on the table that we want to talk about? I get why it may not be the top priority right now, but is that something that we want to revisit at some point?
No, absolutely it is. I can tell you why it kind of took a back seat. For a couple reasons. And one was obviously COVID, right? So that definitely a reason. But the real reason I think this kind of got put on the back burner a little bit is that at the same time this was launching early stages, and I see that Mr. Bravo joined, you can talk to this a little bit, is college and career academies were also launching. And so we had two competing messages, and these large corporate partners who over decades obviously do support endowments, we were partnering with them to create college and career academies through the United Way. And some of them were sizable financial contributions as well as human capital contributions. And so the decision there, collective board administration decision at the time, was to not have those two compete. Now, the vision where I talked about of this full endowment in different buckets where people can contribute and up to and including high schools, which I agree with you would resonate very well from alum, is I think it's time to put the plan back out there. Margaret Medsey and I traded emails. It's been a few months ago now, but this is something that we'll add to our 2000 fiscal 22 strategic plan and finance committee. So yes, it is.
Yeah, because all those folks who were, I mean, again, a lot of those, again, from the hundreds of people that that were emailing us, calling us about Garfield High School, that's where you say, hey, listen, are you also willing to contribute on an annual basis to a Garfield endowed fund that benefits your high school? If I got to ask tomorrow, hey, would you commit to giving, $100 a year to North? Yeah, I would do it in a minute. It's easy, or $20 a year. It's whatever it is people can afford. I mean, like,
right.
I think that, like, I think we're just leaving money on the table here in this community, and you can also even set to do contests, where you have different fundraising events, or Booked is going to host a fundraising event, annually, right? I mean, like, a lot of the nonprofits host fundraising. I mean, Boys and Girls Club does Aspire, Boy Scouts does their own thing. They all do their thing. I mean, I could see there being an annual event, that we either do at the cluster level or at the city level that allows people to kind of come and contribute to. All right, I'm getting excited about this, so I'm gonna stop. But let's talk more about this offline, because again, I think this is a huge thing that we could do. So
I agree, and I think it's time that we re-energize this initiative. Yeah. Okay, one more item on the list, and this is the business part. And with upcoming board meeting on Monday, let me go back to sharing my screen. Hopefully you're seeing the Appropriations Resolution.
Roger that.
This is some business, and this is our end of year appropriations. Now, this is an example. As you can imagine, this fiscal year we had lots of moving pieces with ESSER funds and maintenance of effort and all the like. But you will receive a resolution that looks like this that you haven't in your board packet yet, and you'll be getting probably Monday morning. And I always appreciate you scheduling a board meeting at the closest part to the end of the fiscal year, because it has a lot of the mechanics of how we end our year, what our general fund looks like, what our annual spend is, where we spend those dollars. You'll see this follows along right with the 5-year forecast. But then all of the other funds, this is the one time a year that we are putting to bed all of our annual spend. And when I talked to you in the board meeting last week about, hey, this is a $600+ million organization, this, up to and including and even more next year with ESSER funds. This is when we put it to rest. And then this is when we temporarily appropriate next year. So I'll bring in Patrick here a little bit, whether he wants to participate in the conversation. So between now and September 30th, we are formalizing the 21-22 or the fiscal 22 budget. And that's where I showed you the budget priorities, and we will get that updated to reflect all of the ESSER priorities that is being submitted here, obviously in the next couple of weeks. So I just want to draw your attention to this. These are big dollars. Ask any questions that you may have. We can highlight any of this in the open board meeting as well.
Hey, Ryan, is this what you were showing? That was just an example document, right?
That was last year's permanent appropriations resolution.
Okay, because I was like, wait, this says fiscal year 20. Okay, gotcha.
Yeah, we will be working on this one up to about Monday at noon. The reason that happens is, as you can imagine, purchase orders, summer needs, payments go out. We try not to hold up any vendors and not pay them during this time, but basically from the 28th to the end of the year, nobody does any financial transaction, because the auditors come in and they say, well, what did you encumber? What did the board authorize you to spend? And we try to get those as tight as possible, because that's our fiscal grade card. So that's why you see in the management letter comments, oh, your expenditures were $25,000 more than your authorization, because we have no control when we have an emergency purchase for summer school. You have to do it. And we'll take the management letter comment every year, but we're going to order the materials. So those are the things.
Hey, Ryan, so are there rules? So I know, so my experience is predominantly with federal contracting and federal appropriated dollars, i.e. through DOD, for example.
Sure.
And I know that, for example, if when Congress appropriates us money every October, well, if we like it to be October, sometimes it's late, right? But there's certain buckets of money that I can only spend in that fiscal year. And if I don't spend it, I lose it, right?
That's correct.
And also there are rules around purpose, time, and amount. And I've got to spend it for a bona fide need or purpose that has to be addressed within that year. So for example, I can't buy ink pens to last me into 2025, right? So, I can only buy for that fiscal year. And so I must say, anything beyond fiscal year 2021, I got to wait till I get my next appropriation to buy for fiscal year 2022. I'm assuming that, are there similar rules here for federal dollars that we're receiving, limitations around purpose, time, and amount?
It is, and those funds I highlighted on the screen now are any 400 level fund and 500 level fund is a state and or federal grant. Some of these have carryover provisions, some of them don't. They're very specific. They're on the left-hand side of the description and the amount. So almost $70 million of additional state and federal, we call them grants, where we're required to spend them in the fiscal year and have very tight reins on these dollars. Okay, gotcha.
And
this is what the Karen Gijics and the Kenya Harringtons and others manage. As you can see, Title I, 572 is $20 million. This is the size of a small district school budget.
Mm-hmm.
So they're overseeing hundreds of employees and millions of dollars. And so yes, very similar to what you're mentioning, and I'm sure very similar guidelines and purposes for DoD stuff.
Okay. Gotcha. Okay. So of that $600 million we're talking about, you mentioned this year, 70 million of it. Are there other buckets, I guess, beyond this that are that are federally sourced?
These are the federally sourced. So any 500 number you see, ESSER, special ed, Carl Perkins, which is vocational school improvement, fruits and vegetables. There is one more, Dr. Hall, and that is food service.
Gotcha.
Food service, for example, federal reimbursement. So that actually, it may have even been on the audit last year. And remember that schedule of findings where they look at food service a lot because it is so much money.
Gotcha. So Ryan, so money that we get from the state, that's our per pupil contribution.
Yes.
That's a very large dollar amount. Obviously, it's much larger than, I'm sure much larger than $70 million. So those dollars are dollars that ostensibly could be spent beyond the fiscal year.
Some of these can, if that's what you're asking. Some of these 500 federal funds receive some carryover. You have to ask permission to carry over more than 15%. Okay. And I know with some of the ESSER language that's come out over the last year, they've extended some of those carryout provisions. The state grants do not. If you don't spend these monies here, they're sent back.
Okay. Gotcha. Okay. So I'm going to ask a really dumb question here. I should have asked this a year and a half ago.
These are not dumb questions at all.
I didn't think of it before, but because I guess in my mind, when I think about the state contribution to per pupil spending, I thought of that as kind of being one line item, one gigantic line item. You know, that $6,000 per pupil of their high school, $4,800 if they're in grade school.
That's here, yes.
What number is that?
That's general fund, and so that is our state. It's called state aid or state foundation aid. Mm-hmm. That is the process in which they start with the 6,020. That's what we've been working on with the Fair School Funding Plan. And then every state in Ohio is ranked from poorest to wealthiest. And then that's how they split that 60-40 relationship. So 3 steps in that process. What is an adequate education for a typical child? 2, what is the state and local responsibility? Meaning how wealthy is a community and how much the state going to give, how much is the local going to raise. And then 3, what other supports above and beyond a typical child do they need? Transportation, gifted, special education, and all the other categories. So that's represented in about the $350 million budget that we put together every year. Okay,
so that number there, then those are all dollars that. So I'll ask a question. So those are all dollars that must be spent within the fiscal year.
These are general fund is unrestricted. We don't have to spend it. We can carry it over. We can carry it over into perpetuity. And you'll notice that from the May 5-year forecast and coming up in November about kind of the impact ESSER funds are going to have on our cash balances and stretching us out into the future. So these are unrestricted dollars.
Gotcha. And then the other part that you showed me that were the 400 and 500, that 70 million, that's not a part of that 360. That's a separate, distinct.
Correct.
Okay, gotcha.
And total up all those different enterprise and capital projects, and you see health insurance fund, workers' comp, severance, and then some fiduciaries, and you can see endowment. We have one actually specified in OOA's endowment. Might even be one of the funds we talked about today for a grand total of $586 million.
All right. So general fund we can carry over. We just can't take the carryover amount and park it into an investment vehicle that's not prescribed by ORC.
You got it.
Or move it off our books. Okay, that's okay. It's all coming together now. Thank you, Ryan. I appreciate it.
Wonderful. Anybody else? So 10 after 1. Thank you very much for tuning in to those of you watching, and thanks for our board members for joining. I will get you a summary for Monday. Again, talking to the board president that Monday may look a little different because we're trying to fit in a board retreat, whether we do that earlier or whether we keep the business to 30 minutes or less and then do the retreat after. I think that's probably the only way that we're going to have all board members present. So I will talk to Dr. Akbar here this afternoon yet.
That was Monday, you said, right? So we,
Yeah.
I think we're still. I mean, so that was the. Oh yeah, because we're trying to do all that in that 5:30 beyond board meeting, right?
Correct.
So the retreat will take place during that board meeting.
Yes.
Okay, roger that. Okay.
We'll probably reformat reflections and those kind of things. I'm not sure what presentations we have. I think we have a spring sports presentation. We might want to keep that, obviously, with schedules for kiddos. And then we go right into the business.
Roger that. Okay. Thank
Okay.
you so much, Ryan.
Oh, yeah. Thank you very much. And I will see you all Monday.
All right.
Thanks,
Okay.
Ryan.
All right.
Thank you. See you.
Thanks, everybody.
Bye-bye.